The summer's COVID cases and hospitalizations have been really hard on doctors and nurses.
So what is it really like on the front line? Dr. Leo Lee is an infectious disease specialist with Beverly Hospital. He's joining us now to share his perspective. Dr. Lee, thanks for being here. And as someone who's been treating COVID patients since the start of the pandemic, can you tell us exactly what you're seeing in your practice?
Good morning. Yeah, thank you for having me. It has not been a fun summer. Actually, we got a little reprieve during the spring, but since the beginning of July, we've seen our numbers starting to tick up again. In fact, they have gone up over the last 2 months, although I think in the last week or so, I think our numbers have actually plateaued. We are still seeing quite a number of sick patients. Our ICUs are full right now. It's a slightly different demographic. We were seeing older individuals earlier. Now we are seeing the age group about 20 to 40. Most of these individuals have no medical problems. They're perfectly healthy. They didn't think they were at risk for getting COVID. The vast majority, I would say about 99%, are not vaccinated, come in very, very ill. Many are on ventilators. We are really kind of at a loss for treatments. The treatments that we have available for COVID are very limited. One of the drugs that we're using actually has emergency use authorization. It's currently in short supply right now. There's a national shortage. So there's really not that much out there, which is why we're encouraging people to please get vaccinated. That's your best defense against COVID. And you don't want to infect your family. We've seen multiple family members, households coming in. So please do that.
At the same time, we have seen, of course, with school back in session, a number of school outbreaks. Health officials, though, saying many of these are positive asymptomatic cases, and there hasn't been a lot of classroom-to-classroom transmission. So what does that tell you about the current, situation, the spread, and where we go from here?
Well, we've actually had a few outbreaks in LA County. In fact, a couple of weeks ago, we had 3 outbreaks. Last week, we had 8 outbreaks in the school. Well, the schools themselves right now have a protocol in place, including symptom testing at the entrance. They should be doing weekly testing. They are actually sanitizing high traffic areas, sanitizing bathrooms, and whenever possible, trying to move activities outside. What we actually recommend people do is, in terms of things that you can do to safeguard your child, is number one, teachers and parents should get vaccinated if they haven't done so already. The fact that if they get vaccinated, there's less chance of them bringing it into the classroom and bringing it home. On top of that, if your child is eligible for the vaccine, if they're 12 or above, please get them vaccinated. That's your best protection. Right now, as of last week in LA County, 48% of those 12 to 15 were actually fully vaccinated. 57% had were partially vaccinated, had 1 shot. In the older group, 16 to 17, 57% were fully vaccinated, and about 68% were partially vaccinated. So we encourage kids to get vaccinated if they can, if they fall in that age group. The other things we're trying to tell kids is in terms of things they can do to mitigate their risk for contracting COVID, is to do the same thing they've done all along. Continue masking, social distancing, avoiding crowds. If you're indoors, please wear a mask. If you're outside, unless you're in a crowded situation, you don't really need to wear a mask. But if you're in a crowded situation, wear those masks. But we are sort of seeing outbreaks for sure.
All right. Dr. Lee, thank you so much. We really do appreciate it. You have a good weekend. Excuse me.
You too. Thank you.
Take care.